Hello everyone, welcome to this class. Today let us look at an interesting topic, that is the importance of psychological interventions in the rehabilitation of the chronically ill. Now many a times people who are chronically ill, in spite of all their illnesses, do achieve a very high quality of life, and this is a very fortunate factor, and it can also be aided by a number of things such as the absence of pain, or that the disease is no longer advancing and such kind of advantages. And people do achieve at least as high a quality of life as before, and sometimes even a higher quality of life. But leaving aside this factor, which can be a very fortunate occurrence, the reality remains that for many chronically ill patients, depression, anxiety, stress, dejection, and a whole lot of negative emotions are in fact a very natural consequence. And not only are they a consequence of illness, but they also affect illness outcomes. These negative emotions, particularly anxiety, especially neurotic anxiety, that is extreme anxiety, depression and stress, not only aggravate the existing illness, but it also increases the chance of mortality. In fact, depression and anxiety are the greatest factors, the greatest contributors and predictors of mortality that follows a chronic illness. Now, the fact that depression, anxiety and all these negative emotions do occur in chronically ill patients now and then occasionally, it's not something that is going to go away, it is going to come back again and again. And since we know this fact, many psychologists believe that psychological intervention should form an extremely mandatory part of the rehabilitation of chronically ill patients. In fact, they believe that along with the diagnosis and along with the initial treatments, an analysis of these kind of psychological necessities and the development of these kind of emotions becomes extremely important, so that care can be taken right from the beginning rather than waiting for the patient or for the caregivers to come back at some later point of time when the patient is already in an advanced stage of psychological debilitation. In fact, special care should be taken according to psychologists for specific group of patients who are already vulnerable to some kind of emotional problems. Now, certain patients may be there who have already suffered from some kind of mental illnesses or who show vulnerability to mental illnesses due to the circumstances in their life, or who already have been people who have experienced a lot of stress. Now, such people are going to be more vulnerable to anxiety, depression, dejection, frustration and all those negative emotions that are going to accompany chronic illness. Hence, such patients need to be given special care. So, in today's lesson, what we are going to see is the different kind of psychological interventions that can be useful for a chronically ill patient. Psychological interventions for chronic illness. Now, a wide variety of psychological interventions can be used for chronically ill patients so as to assist them on the road to recovery. Now, one basic psychological intervention that is used is pharmacological intervention, and this intervention may not be prescribed by the psychologist alone, because even though psychologists have been fighting for this right, till now they do not have received complete rights to prescribe medications. So this step may be taken in collaboration with a psychiatrist who can actually prescribe medications. So pharmacological interventions are going to be targeted especially for those cases in which the prognosis is poor and the emotional disturbance is very severe. One major area in which medications may be commonly prescribed are anxiety and depression, because most of the medications prescribed for chronically ill patients consist of anti-anxiety medications and antidepressants. In other severe conditions, say for example out of severe depression or severe anxiety, the patient is losing reality orientation, then in such cases also pharmacological treatments may be an option, because before counseling and other forms of psychological intervention such as psychotherapy start, it is important to bring the patient back to a level of normalcy and bring the patient to a level where he has a right orientation with reality before we can start counseling or treating him. A second major therapy that may be used for patients is of course individual therapy. It focuses on dealing with the individual based on individual needs. Now, individual therapy may be very different in fact when you're talking about the kind of psychological individual therapy given to patients who have primarily psychological disorders as compared to the kind of therapy given to patients who have primarily physiological disorders, and you are treating the emotional disturbance which is a symptom of the physiological disorder. So what can be those kind of differences? The first difference is that when you are treating the emotional disturbances in a patient which have primarily come from the existence of certain kind of chronic physiological illnesses, the kind of counseling and psychotherapy given may not be continuous. For patients who have psychological issues, that is primarily psychological issues and purely psychological issues, the counseling and psychotherapy may need to be continuous. So you cannot have many breaks in between. Whereas for chronically ill patients, it will be more on a need basis. Say suppose the patient today has a need, since he has received a very bad news about the diagnosis, the counseling may be there. But after some time, when the patient has coped up with the situation, this continuous need for counseling and psychotherapy may not be there. Maybe sometime into the treatment, suddenly the patient may find out that he or she cannot really cope with this kind of treatment, or there may be a sudden change in the treatment regimen. Then again in such states, the counseling and psychotherapy will have to start. Maybe 3 or 4 months into the illness, the patient, due to the effects of the illness, may have some kind of serious conflict with, say, a daughter or a son or any other family member. Again, the psychologist may have to step in such circumstances. Say again the patient receives after, say, 4 or 5 months again a worse diagnosis. He or she finds out that the cancer has come back, for instance. So again the counselor will have to step in. So it is more on a need basis. It is more occasional rather than on a continuous basis. A second difference between therapy that is given to patients having psychological disorders as compared to those having physiological disorders is that when you are dealing with patients having chronic illnesses, physiological illnesses for that matter, the kind of treatment you will give will also depend upon your collaboration with a number of people. You can't just deal with the patient alone. Of course, you have to deal with the family. This may also hold true for mental illnesses. But here you will also have to deal with the physician. So it is kind of a collaborative effort with 3 people involved, the patient, the family, as well as the physician, because only the physician will be able to tell you very well about the symptoms, the diagnosis, and the different aspects of the illness. And this information and this continuous feedback about changes in medications, changes in treatment regimens is very important for the psychologist to decide what kind of therapy and what kind of counseling has to be initiated. Another difference in the kind of counseling that is provided to mentally ill patients as compared to those who have physical illnesses is that when a patient has physical illness, we may respect all the defense mechanisms the patient is using. When you are treating a patient having primarily psychological illnesses, you may try to bring the patient back to the reality, help the patient face the reality, and not use any defense mechanism such as engaging in wishful thinking or repressing the reality or denying the reality and so on. But if a patient having a chronic illness, particularly a terminal illness, say cancer or any sort of such illnesses, is using any defense mechanisms, is denying the reality, is trying to repress the negative information, we may not actually challenge the patient cognitively. We may allow the patient to keep the defenses because that actually may be a legitimate way in which the patient is coping with the disease. And finally, when a psychologist deals with a patient having a chronic illness, it is very important for the psychologist to have a very thorough understanding of all the illnesses, symptoms, illness outcomes, and treatments that the patient is undergoing. Unless this comprehensive understanding about the physiological makeup of the patient is not there, the psychologist is not going to succeed in understanding the wide range of problems and providing comprehensive counseling and therapy. Another kind of psychological intervention that can be commonly used for patients having chronic illness is brief interventions, brief yet intense interventions. This may include brief informational therapies where the basic thing is to improve the kind of communication between the patient and the caregiver and the patient and the physician. In fact, providing information to the patients about the kind of diagnosis that has been obtained, about the kind of treatments that will be undergone, and what are the reasons for taking up such a treatment, what are the possible outcomes, what kind of experiences that may be involved in the treatment. Giving all such information to the patient actually can be very useful and can reduce a great deal of anxiety, can reduce a great deal of worry, and can also make the patient feel much more in control of the situation and reduce depression. So basic informational therapies itself can promote psychosocial adjustment and well-being both in the patient and the caregiver. Apart from that, psychologists today are very encouraged by the effects of brief psychotherapeutic interventions. Here, short-term programs are organized for certain patients depending upon their specific necessities. For instance, in one basic research on this conducted by Telk and Telk in 1986, they conducted coping skills training for a short time, that is only 6 weeks, for cancer patients. And they found out that this kind of intensive training improved self-efficacy, improved feelings of control, reduced feelings of anxiety and depression, and made the patients feel that they had a lot more left in life. It increased the patient's sense of meaning in life. And the effect quite significant as compared to other kinds of therapy such as supportive group therapy and other long-term therapies. So today psychologists are also focusing on these kind of brief therapies that can give intensive training to the patients and which can have quite quicker results. Another thing that can be taken into consideration and which psychologists do today commonly to help patients with chronic illness is patient education. Now, patient education would also mean caregiver education as well. In patient education, the patient is educated a lot about what his diagnosis of the illness means and what he should expect in the future. This can include both the lifestyle changes he is expected to make and the reasons behind those changes, how they are going to help him, the kind of treatment regimens that may be planned out for him, whether hospitalization will be involved or not, and what kind of outcomes and prognosis he can expect. So this kind of comprehensive patient education gives the patient a lot of control and a lot of satisfaction about his own knowledge and his own participation in his treatment process. Further, caregivers can also be given a lot of education about how to take care of the patient and how to understand the patient's responses. Many a times it becomes very important to educate both the patient and the caregiver that a lot of emotional responses such as anxiety or depression following the diagnosis of a chronic illness is normal, because many caregivers feel that this is an abnormal response and they go all out to stop the patient from responding in this way, which can in fact exaggerate the kind of problems that are existing. So it's important for caregivers also to be sensitized that all these emotional reactions are normal, and it is healthy in fact to encourage the patient to vent out his emotions up to an extent, because once those emotions come out, after that recovery period starts. Another important psychological tool that psychologists are interestingly using today is internet. Now the internet is a platform which can give the patients a whole lot of information about their illness and about the kind of treatment options and support that is available. Of course, psychologists must advise the patients regarding a very discretionary use of the internet, because there may also be a number of sites and sources which do not give accurate information to the patient. But if the internet is used carefully and is used judiciously, it can be a source of information. Further, it can also be a source of social activity for the patient, because initially there were support groups for illnesses that used to meet face to face. But today what is the trend is a lot of online support groups for illnesses where the patient can discuss his fears, discuss doubts, and get a lot of answers and feedback from experts or from other people who are going through similar illnesses. In fact, research reveals that breast cancer patients reported a high level of self-efficacy, higher levels of functioning, and lesser levels of stress when they surfed the internet and depended on the internet for a lot of information regarding their illness. And this also does not require a lot of time on the internet. Research reveals that even 1 hour of internet surfing on the week in the right way, which gives the right information and social support, can bring about a lot of difference. Another very important psychological intervention that may be used is a host of stress reduction techniques. and stress management techniques, because stress, as we know, is one factor which can not only cause illness but can worsen the outcomes of illness and treatment. A host of stress management techniques, including exercise, meditation, yoga, and many such techniques can be used as social skills training. One technique which is commonly used these days and which has found very encouraging results is relaxation training, in fact. Now, relaxation training, particularly mindfulness-based relaxation, or what is also called mindfulness-based stress reduction, the MBSR, is quite effective. It works on the principle that stress is, of course, an inevitable part of life and we cannot deny it, but we can self-regulate and control the kind of emotions that we have in response to stress. We can ensure that we do not react negatively to stress. So what mindfulness-based relaxation does is to elevate the person's state of functioning, state of mental functioning, to such a high level that he is completely self-aware of the entire situation, and he also has a high level of acceptance and acknowledgement of the reality, including a stressful reality. And this kind of mental dealing with the situation prevents him from engaging in any kind of negative emotions in response to the stress. So mindfulness-based relaxation believes that when we deal emotionally to the stress, we deal automatically towards a stressful situation and not a lot of negative outcomes come through. Whereas if we deal with the situation more at a thinking and a mental level, we can regulate our emotions and, of course, the amount of stress that we experience. Another important technique that can be used, of course, is various techniques of expression. One basic technique is expressive writing. In fact, many chronically ill patients, there was a study in fact done on patients with renal cancer who felt that when the group of patients who actually wrote about the cancer, about the symptoms, about the experiences in their journals, who made regular entries, in fact, had better quality sleep, longer amount of sleeping time, and lesser amount of sleep disturbances. Because any form of expression of emotions, in fact, lightens the mind, lightens the brain, and allows you to experience a greater level of relaxation. Now, for some people, writing can be therapeutic, whereas for others, a number of other things can be. Say, for instance, music can be therapeutic for many patients. They may want to listen to music for long durations, particular kind of music, which gives them this therapeutic effect. Others may use colors and painting as an expressive technique. Some others may opt for visiting or companion animals to whom they can express their feelings, and so on. The basic factor here is encouraging a healthy expression of feelings, because once feelings are expressed, then the patient can move on to the road to recovery. Another two key issues or two key strongholds that a psychologist often uses in rehabilitation is that of social support and the family, because these are two key points that can actually make quite a difference in the patient's life. Now, what is social support? Social support is all the support a patient receives from the society in different ways, and this is one basic factor which is also going to get affected when the patient falls ill. When the patient falls ill, social activities do get affected. The patient may not be able to go out and visit people and participate in a number of social gatherings and activities. And automatically for some time, the other friends, relatives and others may come down to visit him. But that also may stop after a few days, because people are also busy with their own lives. And there is often a social vacuum which is created. This kind of vacuum can be extremely painful, because the patient feels that this illness has isolated me from the others. Often others in the patient's surroundings may also have a lot of misunderstandings regarding the illness or some kind of stigma involved, or they may simply not know what kind of help that they can do to the patient. So all these factors may jeopardize social relations. So here the psychologist has an important and a very key rehabilitative role to play. Not only must he reteach, in fact, patients newer social skills, encourage him to go out and participate in as many activities as possible, and if possible, bring certain social activities to him if he cannot move out. This may involve counseling friends, relatives and others. Also encouraging the patient to identify certain interest groups or support groups where his particular needs as a patient, his social needs as a patient will be catered to, or taking part in any activity that he enjoys, such as music or spiritual activities or anything of that sort, can also be an important area for counseling and training the patient as far as the psychologist is concerned. As I said, the other key factor is the family. Family, of course, is there to take care of the patient, but there can be a lot that a psychologist can do to improve the family's capacity to take care of the patient and improve his well-being. One thing is, of course, family therapy, which can improve the kind of relations that family members have, because the extreme pressures that are involved with taking care of a chronically ill patient may actually create a lot of tensions, conflicts and irritations between the family members. So a psychologist can intervene and plan out a lot of things for the family. For instance, they can be trained how to plan out time, how to take the help of other sources and other caregivers to make caring for the patient a bit more easier. They can also be helped to understand how simple leisure activities, simple family gatherings can make such a lot of difference in taking care of the chronically ill. Also, they can be encouraged to take time out for themselves with appropriate social support so that they themselves do not experience a lot of stress and burnout of this experience of taking care of the chronically ill. They can be also taught a number of useful tips. Say for instance, how can they improve adherence in the patient? Certain aspects of the patient's lifestyle, such as dietary restrictions or exercise, can actually be incorporated into the family routine itself. The entire family can go out for jogging, say in the morning or the evening, so the patient doesn't feel alone. He doesn't feel that adhering to a treatment regimen is just his own responsibility. Similarly, the family also has to be sensitized that a chronically ill patient, of course, will have a lot of extreme emotions behind him, and you cannot always force the person or remind the person to be cheerful, because if the family puts this kind of pressure on the person may often feel that no one understands him, and he may turn out to hide his feelings and be artificially cheerful, which will not do much good to him. It's also important for the family to understand that at times the patient should be allowed to vent out his emotions, to express his emotions freely, and after that the patient can be reassured that the family is always there with him and his mood can be improved. Now, one important what we can say resource that psychologists do use and should use very effectively for psychological rehabilitation is this concept of support groups for chronically ill patients. Now, these support groups may be of different types. It may be a psychologist who is regulating the support group. It may also form a part of group therapy, in fact. Or it may be a physician who has formed this support group, or it may actually be patient managed. So in any case, what does a support group constitute? A support group constitutes a number of patients or a number of people who are suffering similar kinds of chronic illnesses, who are facing similar challenges in their lives. Or it may also constitute family members or caregivers of patients having similar illnesses. Now, support groups can actually provide a lot of support in the real sense of the term. Usually, initially, in initial days, support groups used to constitute more face-to-face interaction, maybe, several support groups in a city or in a town. But today, as the online culture has developed, most of support groups are also online. So you can easily, join a support group of, say, cancer patients or patients having renal disorders or patients having stroke who have gathered from different parts of the world. And support groups can provide a lot more than emotional support. They can actually provide you a lot of information, because these are people who have already gone through what you are going through, or who are in the process of going through the situation just like you. So they also may already have a lot of information reserves, or they may be actually searching for information, and in any way it is going to be helpful. They can tell you a lot about the diagnosis, about the various treatment options, where best care can be obtained. Also, they can tell you who can actually support you in these situations, what kind of practitioners or what kind of caregivers or healthcare providers are the best, and so on. They can also give you a lot of ideas how to go about treatment regimens, how to go about lifestyles. In fact, research has found that patients who are participants of support groups are in fact a lot more encouraged to adhere to treatment. Possibly because when you agree to adhere to a certain treatment practice in front of a support group, you are agreeing to compliance or making a promise in front of a lot of people, and hence you have more motivation to actually go ahead and fulfill that kind of commitment or promise. Secondly, when you see people who are suffering similarly like you, who are also motivated and are doing things to get back on their feet, it gives you a lot of encouragement, in fact, to go through the same process, and you have this feeling that if he or she can do it, why not me? So this kind of encouragement which is available in a support group is also something very important. Like, patients can check on each other's progress, they can remind each other about the kind of treatment regimens they have to go through, and they can provide constant motivation and encouragement. In fact, for caregivers also, support groups can be very essential, because many a times caregivers may have a lot of problems, or they may need to vent out a lot of emotions, which can easily happen in the support group format, especially because there are other people also who are facing similar stress. So you can easily get a listening ear. You can have someone who will not just listen to your problems, but who will also understand the problem, because they themselves have been or are in a similar situation. So that kind of an opportunity to express your feelings itself becomes a great stress reduction mechanism. Hence, psychologists often encourage patients and their caregivers to join such support groups, or in fact they themselves can organize a few of these support groups wherever they are working for the benefit of the patients. Conclusion. Now, as we have seen within the scope of this chapter, a large number of psychological interventions and rehabilitation mechanisms are really available for those chronically ill patients who are dealing with a lot of complex problems. And these interventions can be really highly useful for them as they struggle on the road of recovery. Even though a lot is available, psychological interventions are not given equal importance on par with the physiological interventions. In fact, a lot of the focus remains on the physiological rehabilitation of the person and his physical well-being, whereas the emotional burden and the emotional problems do take a backseat. In fact, physicians and healthcare practitioners need to be sensitized in this sense, so that the regular medical care program of a chronically ill patient also necessarily has the psychological component included in it. Because if this is not there, often a lot of psychological problems do come out only when they are in the advanced stages, and little can be done about it. And through the entire process, these psychological problems also affect treatment adherence and the treatment outcomes. The fact also is that even though a lot of psychological interventions are available, they are irregular in the sense that they are not properly planned, they are not properly managed, and they are not properly orchestrated. They do not have a very comprehensive approach and do not take into consideration the specific needs of individual patients. In fact, even though such a lot of options are available, particularly in developing countries such as India, most of these options are unknown and underutilized as far as physically ill patients are concerned. Some kind of management and some kind of orchestration is necessary if these programs are to actually come down to the patient and benefit him. The result that happens when psychological rehabilitation programs are not incorporated into the treatment plan of chronically ill patients is that there is a heavy burden on the caregivers, a very disproportionate burden on the caregivers. Because although the treatment regimens from the medical side are continuing, all the emotional burden comes down to the caregivers who themselves are in a need of care. So when psychological interventions are incorporated, not only does patient well-being improve, but it also improves the well-being of the caregivers. Not only is it necessary to implement a program, but it is also important to measure the outcomes of the program, because when we have such kind of outcome measures of the success of a program, it becomes easier to implement it for other patients in similar conditions. And this requires a concerted effort and concerted sensitization and concerted knowledge on the part of the patient, on the part of the caregiver, and on the part of the healthcare practitioners. Hence, if you are any of these, or if you are a student who is going to deal with any such situation in day-to-day life, be sure that when you come across a chronically ill patient, ensure that he or she has the psychological rehabilitation component very strongly emphasized within his treatment plans.